Joe.
Okay. Please tell us your name and title.
My name is Suzy Suyin Matsuda. I'm a licensed clinical psychologist and I'm also a licensed clinical social worker.
What are the unique challenges you face as a healthcare provider in getting patients to access healthcare in this region?
I think part of it is having a public service announcement where...
Sorry, do you mind rephrasing my question in your answer?
Okay.
So, what are the unique challenges you face as a healthcare provider in getting patients to access healthcare in this region?
So the challenge is to get patient access to healthcare in this region. I think that, first of all, I think people do not know where to go. The second thing is they don't, what are the signs and symptoms, especially for behavioral health. Oftentimes, the ethnic community in these regions, they probably wait until they cannot go to work or they cannot attend school anymore, or there is a severe conflict in the family. When there's really impairments, then they seeking help. But by that time, they don't even know where to go. And the other piece is with behavioral health issue, with mental health issues, there are other issue with stigma, concern with confidentiality, and also because of the lack of education that mental health services, mental health, behavioral health really is, it is also a medical condition. And so a lot of time people don't know what it is and interpreting subjectively and think, oh, if they get married, they're gonna, you can feel better. If they get a job, they're gonna feel better, all that. So I think the lack of education, understanding very public education about mental health, and understanding mental health is the public health issues, and also having community healthcare system really outreach to these ethnic communities and really provide that education, provide that relationship with the community. I think that having relationship, service provider having relationship with the community members really is a way to facilitate as well, to help them feel more at ease, more comfortable, more trust involved. They can come in and seek help.
Can you talk about delivering high quality care to our patient population?
Talk about delivering the high quality care to our patients.
Or in other words, what does high quality care mean to you?
High quality care means to me that is holistic health, that integrated care. I think that we need to look at an individual holistically, that physical health and behavioral health or mental health, even dental health, it's all interconnected, and also social health, spiritual health, it's all related. So high quality of care is to look at it in a different perspective, multidisciplinary team looking at assessing the needs, and not just putting the responsibility in just the patient, but I think that we all have the responsibilities in one's person wellness, and I think high quality of care secondly would be empowering the individual to the patient to take the ownership of their treatment. That also means that they are feeling comfortable to ask questions, feeling comfortable to discuss their issues and things that are important to them, their wishes and dreams, and their preferences with healthcare providers, and that they together can come up with mutually agreed upon remedies and treatment plans, and then starting where the patients are. I think high quality of care is having a lot to do with compassion and empathy, and respect, and focusing on the empowerment of the patient.
How do you collaborate and collectively work to ensure successful care?
Okay. How do we collaborate to ensure the successful care for patients. Um, I I think for behavioral health, we always wanted to make sure if it's okay with the client signing the consent form so that we can talk to the family physicians, their family physicians, or their dentists, or people that in their care. Sometimes for a child would be the teachers, as the school psychologist, parents, other people in that part of their care. So I think that at that level, a person in that environment, but as far as a system of care, I think those of us who providing healthcare, we need to sit down. And I think we have done that, sitting down together, assessing the needs as a community, and come up with solutions, come up with ideas, and involve the patients into the discussion, into the dialogues, and empower them to take the ownership of that care. Yeah.
Can you name one example of an advocacy effort that has succeeded and why?
All right, I'm going to give you a story of an advocacy effort that helped a patient with a mental health condition. So we have a religious nun. I'm not going to say what faith, right? So a nun come to our service, and she suffered adjustment disorder and even depressive sign and symptoms as well, because in her experience she was for her she was sexually religiously harassed by her classmates because of her particular faith, and the rest of her classmates were not in the same faith, and she was bullied, she was put down, she was she was treated with a lot of hostility. So she went to the school, tell the school about her story, but no one listened to her, really listened or really cared about what happening. In the end, they said, why don't you leave the school? Why don't you go to another school if this is not the best fit for you? But in her mind, this is her right, a basic human right to attend the school that she wants to attend. So she suffered depression. She had to go to an acute hospitalization. And after that, she met with us. We found out her story, helping her recover from her depression. But at the same time, we went to victim advocates to report her story and to see whether this can be a case where there's something can be done about it. We're doing this according to her request, right? So however that she feel that it needs to be done for her. Of course we did assess to whether to see the request reasonable, the request makes sense, and we see the validity in her request. So we help her get to the making the report, telling her story with the victim advocate victim witness program, and then they refer her to make a report to the police so that she can be safe from that harassment issues. And then along the way she learned that her case may be of the concern, but it doesn't have all the requirement for a harassment case per se, because but along the way, because we helping her, because we believed in her, because we support her whatever she think that is needed at the time. After she made the report to the police, she got to talk to the people from the police station. She later decided she gonna move to different school on her own, and thinking that that would be a better fit for her. But at this time it's her choice. That's her at her decision, and don't feel like she being rejected by the school, that she being quote unquote kicked out. So we're talking about her mental health, but it having to do with her schooling experience as an immigrant, as a refugee, and then interaction with the police legal system, and how it is for her. And I think she did give us a note saying that the fact that we walked a long way with her, that helped her feel empowered, and that she, through that process, she realized that what she needed to be, what she needed to do, and she made the decision on her own. But because without our support, she wouldn't get there. But I think yeah, we started where she was, and then she ended up with where she was ready for.
Great story. Thanks for sharing. So, what are the challenges posed by constantly having to advocate for funding despite consistently demonstrating value?
What are the challenges to constantly advocating for funding, and then be questions about the values that we producing, correct? Right? I think that the challenges is that the funders, probably, some, I'm not saying all, but some are not fully informed with the complexity of the needs of the population that we served, and the cultural ways of responding from that population, the complexity, and then the extra works that need to be done with these communities. It's not by the books, right? It's not, and you need to take a lot of creativities and innovative ideas and make things happen. And sometimes you have to have that flexibility, thinking out of the box. And I think that funders sometimes don't, not all of them, but few do not see all of that complexity involved. And then the people who managing that fund or following up with the process, because they don't have the direct experience, or that they really out there, so they behind the desk. Sometimes it's hard to understand at all the pressure and the complexity and the needs, and so the deadlines and all the things that we need to comply to, sometimes it's become a little mechanical, but I think that if we all can see the humanity in the process that we are involved with, and give each other the support and the empowerment needed, then I think it will make more sense in terms of supporting projects or program that need to be funded, and yeah.
So, what is your job and why do you do what you do?
My job. What is my job and why do I do what I do? My job is a behavioral health clinical director for Southland Integrated Services. My job, I am developing a behavioral health outpatient services for folks with low income, of folks with that they don't have insurance, but they don't also have Medi-Cal neither, and also for folks with Medi-Cal. These are the low income folks in the ethnic communities, so that they don't have to wait until this condition is so severe and then they will be served by the county. That's the county serving people with more severe conditions. So those with mild to moderate, they have somewhere to go. And the private insurance and the private practice, oftentimes they do not take people with Medi-Cal, or that they vary probably more than the people with low income can afford as far as the fee. So we wanted to provide that individual support treatment. At the same time, I wanted to destigmatize the mental health issues with community education, community support groups, with other programs, speaker bureaus, and all those programs, so that we have provide education, destigmatization, and increase help-seeking response from the community. Yeah.
Can you recall any accolades or awards? If so, comment on them. And this can be either yourself or Southland or the consortia of your award.
Am I aware of the awards that Southlands has been received?
Yeah, can you recall any accolades or awards? And if so, just briefly comment on them.
Yeah, that one I was there, that Southland received the recognition from the Board of Supervisors for their culturally competent services just a few months ago, for the efforts that they've done to have a yearly mental health fair that involve with cultural arts from different ethnic groups, and also for the many innovative ideas that they've done as far as for mental health. Because I in mental health fields I can only talk about that reward. They may have other rewards that I don't know of all of them. But last time Southland, they did hire an artist to help older adults with mental health conditions to learn abstract art and expressing their feeling and emotion, their grief, and their difficult turning points, difficult experiences in their lives using abstract art. And it was incredible results and incredible visual expressions. And that was part of Southland effort. And then every year they had this mental health fair that inviting all collaborate with other ethnic communities to promote mental health wellness. Yeah.
That's really cool. So last two questions. Can you recall any special patient wins or patient stories? And if so, please comment on them.
The special patient story. Well, I had a patient who he was a volunteer for one of the nonprofit program, and he found himself after his mom passed away that he lost his life energy. He had this like panic attack and fear, becoming so overwhelmed that he didn't want to go out of the house. He didn't want to go to that volunteer work. He didn't want to communicate with anyone, and he lived in this fear that he somehow will just fail. He somehow just disappear. You know, there's no life energy and no motivation. So I met him at the time where he trying to make it. He was able to get some medication from a family physician. We were trying to recover from that. We met, and later on he learned about how over the years that he was in Vietnam, the trauma that he'd been through, and the experience that he had here, and another different trauma added on to his brain. And over time, it was so much he could handle. His stress tolerance at the time that was so low, and his coping becoming thin, and his emotional injury for all these years that he's have not taken care of or pay attention to, it took a toll on him. So we focusing on emotional healing, we focusing on his coping, we focusing on the view and perspective that could help empower him to recover from this. We focusing on his relationship with people in his life that he need to reconnect with, to have the support that he needs, and also some healing taking place. So there was a lot of emotional health care that helped him recover and back to his previous functioning. Yeah.
Last question. What is unique about the community that you serve?
A lot of strength. The unique things about the community I'm serving, we have 60% are Vietnamese and like 40% are Spanish speaking or other ethnic groups. The unique strength that I see is, you know, we have patients who've been homeless, or have drug abuse history, and they coming here, getting help for their health care, getting help for their family members, and try to support each other, try to survive and try to thrive. I think that their unique strengths they are so resilient, absolutely very resilient. And these folks, they have a lot of trauma in their upbringing, a lot going on in their lives, and there's a lack of resource. There was poverty. There's a lot of abuse, violence. You named it. Here they are, coming, taking care of themselves, taking care of their loved ones, and try to survive but also thrive. Unique power of resiliency.
Cut.
Cut.